I think, at least for me, that's generally correct. Now, I would say it's a balance between the two. I have heard the same thing, that you don't want to get behind the pain. I think there's general truth to that, but I also don't think you want to err so far on the side of that you never know where the pain is. You have to let yourself get to the point where you're feeling the pain to know where that boundary is. And I don't think you want to be too far to one side of that boundary. You have to bump up against it sometimes so that you're able to kind of get a sense for where that boundary is, because it's going to change, and you have to continually retest it.
Can you describe what the symptoms are like?
So,
is it chest pain?
What are the symptoms like relative to the pain post-transplant? In my particular case, and I think some other patients have had similar experience and others have not, I had two major areas of pain. One was the incision, which I expected, but the other, and in my case actually greater area of challenge, was back pain. Not at all related to the incision itself, maybe somewhat related to being on the operating table and to being then subsequently in a hospital bed and not getting around and not getting the same level of mobility as I was used to. But not every patient has a back pain challenge. Some do, some don't. I sure did. In my case, was a greater issue than the incision. And so, in terms of the back pain, I think most people are pretty familiar with the idea or concept. It wasn't for me one particular area of the back. It wasn't just the lower back or just the middle back. What I can share is that while the chest tubes are in place, and the chest tubes are initially 2 on the left side, 2 on the right side, they go up along the rib cage, parallel kind of, or along the lungs, between the lungs and the rib cage, to drain the saline and excess fluids. Those chest tubes can cause back pain. And then I think in my case were a source of the majority of the back pain. Because when the chest tubes came out, the majority of my back pain went away. The other pain is related to the incision, and to me was much less of a challenge. It meant that it was hard to sleep on my side, and it was very uncomfortable to do that. But other than that, it wasn't much of an issue or challenge, especially with the medications that were available. I think for some of the other patients I've spoken to, the incision has been more painful, but there are some who say it's really been not an issue at all. I think everybody handles pain differently. I think people's incisions are somewhat different. Body shape, geometry, mass, etc. probably factor into it. But at least in my experience, the majority of the pain with the incision has been on the sides below the arms, as opposed to in the middle where you'd expect it. And it hasn't been where the sternum was broken, as I would have expected. I think the key thing about the pain too is you're hopefully not experiencing the full brunt of what the pain would look like at any point in the process. You are 90% not feeling it because you're on the right level of pain medicine, and you're 10% feeling it. And so, the idea is that 10%, and that's my number, not somebody else's, but that 10% is, kind of what you should be trying to manage to when it's at a manageable level. In the hospital, they'll come in and they'll say, what is your pain level on a 1 to 10 level? Well, I'd bet my pain level, if I were to come up with a number now, is very different than it would have been before the operation. And I bet you that different people have a different number for what's probably the same level of pain. It's a very subjective thing. But the idea or concept, as best I could tell, and as I think it makes sense, is that you're not supposed to be without any pain at all, but rather at a manageable level of pain. That's generally that you're kind of managing the balance at the right level, and that within that, let's say I were to say my manageable level of pain is a 3 or less. That might mean, let's say it's a 3, that at its worst, I might be at a 4. At its best, I might be at a 1 or 2. And maybe it's averaging a 3. So it doesn't mean it's a 3 over the entire day. Let's say my pain medicine kicks in every 6 hours. I get to refresh my pain medicine. Well, it might mean that, right after that medicine's fully working, I'm at my best and I'm a 1 or 2. It might be right before it's due again, I'm at a 4. And I'd say, oh, on average, I'm a 3. That's kind of how I think about and have understood, it's helpful to think about the pain medication.